On this day, Makueni health workers arrived at Kwakathoka ATC in style, all ready to bag medals of excellency at work.
We are the people who have that rare opportunity to witness a birth and witness departure from this world. And I want to say, Your Excellency, that is a big call. That in the whole cycle of life, that healthcare workers are always looked upon.
I want to congratulate you. You are gathered here because you have done well. And as was said earlier, you did well even before you knew that at some point there might be special recognition. That means people take their work very, very seriously. And Dr. Molo did say that you work 24 hours and you are there from the beginning of life to sometimes, unfortunately, the end of life.
Your Excellency, we have launched many dispensaries, opened up 120 of them in the last 5 years. But this is the first opportunity that we are looking at ourselves and asking ourselves, what do these dispensaries translate to? The dispensaries translate to skilled birth delivery. More mothers are delivering in our facilities. More mothers are coming to the clinics. More children are getting immunized in our facilities. And to me, that is more important than the physical infrastructure that in the last years we have been launching.
The competing categories were the most skilled birth attendant, the best hospital in family planning, the nurse of the year, rapidly upcoming new facility, among other categories.
Even though we are recognizing certain people here who merit, but the department in its totality deserves special recognition, even those who are not here. I was a little worried when I was told there is recognition, there is some gifting of the Department of Health. I said, what about the other departments? They are going to think that there is something I'm doing special with the Department of Health. But of course, in terms of the transforming health, systems project, it's a special project in this department, and we will ensure that all other departments also, they can have their recognition ceremonies, and maybe at some point we shall even, according to performance contracting, recognize people in the entire county, all the county staff.
The health chief officer in Makueni, Dr. Patrick Musyoki, commended the health workers for having had to deliver excellence even in the most of difficulty circumstances.
Most of these workers here, especially the nurses in the rural facilities, some of them work under very, very difficult circumstances. Some don't have staff houses in the dispensaries where they are working. They have to travel long distances to reach to work. Even the ones who are working in some of those dispensaries and spending there, the ones that have staff houses, some are not fenced, and some also do not have electricity. So I believe very few people actually can go out of their way to continue giving quality service under those circumstances. But we know that it has been the commitment of your government to progressively improve their welfare.
Makueni CEC for Health Dr. Andrew Molwa took time to enumerate several of the quality health indicators where the county is listed as top in the country.
Our skilled birth delivery, our maternal mortality, our immunization coverage, our family planning, all our indicators have improved. Your Excellency, the only indicator that we are not doing well is deworming of school-going children. And Your Excellency, I want to report to you that in the last 1 month, we have dewormed 400,000 children in Makueni.
I think when one follows these indicators, they translate into quality medical care. And of course, if you're good in these indicators, you'll be good in other indicators, because you would be working on all indicators that say that the health situation is a positive situation in a country.
On his part, Governor Kibwana thanked the health team for having put Makueni in a global map over the famous Makueni Universal Health Care.
the Universal Health Care Project, and I think even this particular project by the World Bank is associated with the Universal Health Care. I think it has really been a very, very, very important aspect in the health sector in this country, because at the very least, and we have our brother from the NHIF, at the very least, it showed that this is something that is doable and people can be assisted to access health. And of course, it has meant more patients for you. More people are coming, more people want to be admitted, or you admit them because before they couldn't afford. This is really something that I also congratulate you for, and let us keep the fire burning. Some people think that universal health care is very difficult to do, and therefore it won't work. And how come Makueni now? This is year what? Year 2, and we are still going strong. But we need also to make sure we study what is happening, so that when there are challenges, we are able to look at those challenges, like availability of drugs, the facilities, many people coming to the facilities, the facilities for the wards, a question of staff, and all that. But we are lucky because we had prepared somewhat.
The Chief Officer, Dr. Patrick Musyoki, called for support in specialized training in order to improve on the human resource capacity.
Some have not been able to go back to school. However, we know that progressively you are also going to assist us to make sure that we have enough funds for all our workers who want to go back to school and upgrade their skills.
The training aspect which you said, let us review that so that we can know the extent to which the county can assist more people to go for training. And when they go for training, they come back. They don't go some other places.
Evelyn Mutanu for Governor Press Service, Makueni.